Okay. First, I would like to thank the PSSI and ArtLink for giving me an opportunity to talk about a nurse as a quality manager. So I'll begin with my talk. So in the introduction, I'll tell nurses are one of the trusted group of professionals around the world. They focus on the care of individual patients and family and communities. So once we finish of nursing, so the many things will come in mind. Where do I to start my career, like in hospitals or in colleges or in administration level. So when the conclusion, like once it started in like in hospitals, we can work like as a bedside nurses, then we can promote like senior staff nurse, in charges, managers, ANS, DNS, until the nursing superintendent, and finally you can become a senior of the healthcare organizations. So then if you go on like education part, like you want to be, if you're not would like to work in the hospitals, if you want to continue your career in the educational part, so you can join as a tutor, you can grow like an instructor, associate professor, and college principal, maybe dean of the college. So when administration comes, most of the organizations will be having these two posts like nurse educator and infection control nurses. So my topic of today, which I'm focusing on, was nursing quality. So why not nurses in quality? Yes, the strengths of nurses' role in quality department is what I'm going to discuss now. So all the accreditations like NABH, JCI, whatever the accreditation is goes, they all focus mainly on the quality of care delivered to the patient and their patient safety in the healthcare organization. So as per my concern, other than nurses, no other department will be more caring to the patients, providing quality care on patient safety. They are the one who spends more time with the patients. So they are the best. So once they can have, and they know each and every department, they coordinate with both clinical and non-clinical services in the healthcare. So they will be the best professionals to handle the quality and the patient safety of the hospital. So role of a nursing in a quality as a manager, they do clinical as the ones you get into the post of an quality or to do the audits and patient safety officer. And the patient safety officer is nowadays in most of the hospitals, the patient safety officers will be handling by like some of the non-medicals or maybe like retired police officers or military officers. So why can't the nurse? That is what the question. Nurses can easily handle the patient safety because they are the one who can handle very easy. So when comes the clinical safety officer, the clinical safety officer is the one of the post which was started newly by the NABH as per the 5th edition. It has to be either a doctor or to be a nurse. So then on quality improvement projects, yes, accreditations, one if we get any accreditations, we keep on doing the projects on quality related projects and preparing on manuals, policies, protocols, and nurses are the one to deliver standard safety and quality healthcare to the patients. So these are the 7 parameters should have nursing quality should have, like nurses should have a good knowledge about their quality indicators with their maintaining and organization learning, standard measuring tool, computerized survey, self-evaluation survey. Data should be very transparent. And the important thing was the empowerment of nursing. Always they should empower their nurses to do this. So as if you want to talk about my experience, when I promoted as a nursing quality in the year 2018, and I handed over 2 projects. One was NABH Nursing Excellence, and one was NABH of a small healthcare organization. So both was successfully led and completed in by 2020 June, Nursing Excellence, and in October 2020, the small healthcare organization. So for that purposes, I have underwent 3 projects like fall prevention, hospital upward pressure injuries, pain management and outcomes, and prevention of medication errors. In this, the mainly focus was pain management outcomes. It was newly designed checklist for the EMR and for the manual. So like it was focused mainly on the non-pharmacological managements for the pain to the patients and the outcomes. It was analyzed and it was presented in the present of Aziz at the time of audit, and it was appreciable. So what all the audits have handled clinical audits? One was nurses initial assessment, crash cut awareness for staff, handover process, care plan, sample rejections, utilization of crash cut in critical care areas. So in this again, in clinical audits, which was more interested and which was more, this one was the crash cut awareness for staff was the one. Like, why should I tell this? Because our most of the code blues in the hospitals will be announced in daycare areas, OP days and wards. So when we used to do a mock, I came to understand that the staffs who are working in these areas were less awareness about the crash cards and their location, what all the things are present in the crash card. When with the help of my educators, I started training them. We started practice mocks in our unit itself. Then at one level, when we came to the audit time of the excellence or anyway, so my crash card awareness for the staff was like 90% was that. So for this, even again, I got an appreciation for the training, because every whenever there is any audit of by NABH, they say they will be having this mock on Code Blue. So it went well nicely. So as what all the work I do as a nursing quality. So I was the handling of nursing quality indicators and the reporting of every incident which was there, and analyzing of audits and root cause analysis for the incident which was reported, where the nurses involvement was there, and in preparing of manuals of clinical nursing and non-clinical manuals, process protocols and standard operative procedures, along with infection control manuals also. And training is the one part which is the main focus when become the quality, that we need to train the people of both clinical and non-clinical individual as per each accreditations. So as if I were to tell my experience in quality in NH, as I joined recently 6-7 months back. So I started my career in PITU as in NH, and I started doing audits on medication card, so to error the medication errors, analyzing of events along with my clinicians, whichever the events which are reported by the doctors, clinicians, or my staffs, it will be discussed with my clinicians, and it will be, we'll find out a new solution for that. In that one solution which we have find out is like, we have an unplanned extubations and reintubations in our units. So we sit with the clinicians and we decided a one extubation checklist, which will be showing in the next slide. So that extubation checklist is reduces our unplanned extubations. There we are characterize the patients who are borderline extubations. So then that help us to, the checklist help us to reduce the unplanned extubations. Then we have prepared a one medication dilution chart for my nurses, where that chart contains of all the medicines which are using, whether it may be the liquid form or tablet or antibiotic or narcotic, anything it has in a standard, and it tells us that the uniformity of the dilution of the medicine for the in our unit. So then training of nurses, and I'm helping in the assessing of any accreditations if it happens in the organization. So these are my two checklists. One is this distribution checklist. So this will tell us the how to we can estimate, categorize the patient who was in borderline of extubation. And this is detubing checklist, which recently introduced. So we have to start the audit of this. And so the key lessons and the learning points from this, it's a challenging but it's also rewarding task. Why I'm telling it's challenging? Yes, because put it on anything, any checklist or any process or any protocols, put it on a paper, it's a very easy task. But when it is to implement on a ground level, it's a challenging, because we'll get many negatives from the staff, maybe anybody. So once it gets implemented and it shows its improvements, then we'll get rewards. Then continuous training, while as one of my earlier speaker has said that staff attrition is the global problem. Yes. So whenever we'll train one set of peoples, and one stage they'll be moving to the other organization, or maybe they'll to the abroad, to the other places. So that is the reason continuous training required. We cannot stop the training, and communication is the one which will help us to coordinate with other departments. So then we can easily go through with the quality and dedication and commitment. Don't hesitate to hesitate that you are having like a challenges and all. Please put your dedication and show your commitment. Definitely we can achieve this quality in the departments, and we can provide good quality care to the department and patient safety. By this, I'll end my talk. So I would like to thank one more person, one Mr. Vinod, who has recommended me and promoted me to the quality. So the reason now I am happy to do this thing to my department. So thank you everyone.
Thank you so much.